You know, hospitals are really, they're not accommodating. The floors, I'm just graduated nursing school, so I just spent the last year of my life in a hospital. The fluorescent lights, nurses coming to check you every 5 minutes, blood pressure, cervical checks, beeping noises, not being able to eat. Like, I didn't want to go through that. And a lot of my friends got the epidural and they all have back problems. I just wanted to make sure that if I was going to have a baby, I was going to feel it. I wanted to be completely aware of what was going on so that I can make an educated decision on if I really wanted to do it again.
So I would go to the OB and then I would come to the sanctuary. And when I would go to the OB, it was like I was a number. When I would ask them legitimate questions, I mean, I feel like I'm pretty knowledgeable about birth. I'd like to be a midwife one day, so it's something that really sticks in my mind. But when I would ask the obstetrician, you know, a specific question about something I had a concern about, they would really like brush me aside. They wouldn't really go into it because they treated me like a lay person, like I didn't really know what I was talking about. When I came to the midwives, they took my passion for birth and they fueled it. They gave me the information I wanted. They didn't just brush my concerns aside or my questions aside. You know, sometimes my appointments would go over an hour. It was great.
We were seeing an OB, and with him, the very first appointment, he spent a lot of time with me and answered a lot of my questions. And I thought, okay, I like him, you know. And then every other appointment after that was like pretty quick, and we were in and out of there. And every time I had a question, he pretty much blew me off, and he's supposed to be good. And
I remember each time we left the appointment with the OB, like we were just kind of shaking our heads. Like the worst part about the pregnancy at that point was our doctor visits.
Oh, so the difference was that our appointments then, our prenatal appointments, once we came to the sanctuary, were an hour long each. And they actually asked me questions like, how much water am I drinking? How much protein am I getting? You know, we actually talked about my nutrition and all these things that never were mentioned at the doctors. And I mean, even at the OB, I'd ask him about, you know, my prenatal vitamins, you know, if was I taking the right kind? He's like, oh, whatever, you know, everything was saying was just, oh, everything's fine.
It's good for you, it's good.
So anyway, our appointments at the sanctuary were just longer and more in depth, and they answered all our questions.
It wasn't just that they made you feel comfortable because it was their job, you know, it was like a genuine thing. And, you know, I definitely did not get that with my OBGYN, and it was just kind of like a nightmare trying to deal with him and trying to get some questions and getting questions answered. And they were very curious to see how Joe was doing during the, you know, pregnancy and what his feelings were and what, you know, worried him about it. So that was really
I was very much a part of the process, and I don't think I would have been any otherwise, because it was I mean, her OB-GYN didn't even want me in the room during her appointments. He was a very conservative kind of guy. And I was like, what's going on? You know, that wasn't right with me. It didn't sit right. But here, you know, I was way more involved. It was I guess, holistic care. It wasn't just Angie. It wasn't just the baby. It was us, the whole process and the birthing process and everything all together. It was treated as a whole rather than, you know, like an illness or something like that.
It was a very peaceful, very us-centered thing, or very Angie-centered, very baby-centered process. The stories we heard from the people who went to hospital was that it was much more process-oriented. The focus was on the process. It wasn't on the mother and the child as much. And so that was one of the really, you know, I can't actually describe how nice that was. To be 48 hours of active labor, and you went through, and that was done in candlelight. It was nice and dark, there was no pressure. We had midwives there the whole time, 48 hours pretty much. And very different to the pressure to do cesarean and that sort of thing.
We could have food, we could go walk on the beach, which, well, we did a bunch of walking actually. It was just the ability to sort of go through it at the pace that it needed to happen and not have it be pushed along by somebody else's schedule was really a pretty amazing thing. It was certainly difficult at times. But being able to go through something and have that process be trusted, that, you know, everything was okay, and that, you know, a long labor isn't a dangerous labor or, you know, a bad labor. It's sometimes that's just what the baby needs, and that's what the mom needs. And that was really wonderful, you know, looking back on it and going through it as well.